Okay. A very warm welcome to today's Into Matrix webinar. My name is Alf Torrance and I'm the Executive Director of the Russo-British Chamber of Commerce. I'd like to start today by thanking Jared Balthazar, founder and CEO of Into Matrix, for inviting me to introduce today's event. Today, we'll be taking a look at some of the key issues associated with the coronavirus crisis and its impact on the insurance industry. We're also going to take an in-depth look at what organizations can do to prepare for the post-COVID world and what we're calling the new normal. We have a great panel with a huge depth of experience in the insurance and healthcare sectors. We have, as mentioned, Jared Balthazar, founder and CEO of Into Matrix, Eric Butler, Director of Global Health at Generali, Daniela Masters, Head of Global Health and Wellbeing, also at Generali, Vadim Piombo, CEO at Europe Assistance CIS, and Stephen Spill, a board advisor to Into Matrix, amongst a number of other important executive roles he holds. Today's discussion will be moderated by Norman Ude, Into Matrix's Deputy CEO. Norman, many thanks, and over to you.
Thank you very much, Alf, and also like a really warm welcome to all of you for this nice seminar. Thanks again to Alf for the great introduction, and let me quickly guide you through the agenda for today. So I think we put together not only really a kind of great speakers, but we also put together, like, I think, an agenda which is really interesting and covers a lot of topics which are, in my mind, really kind of actual to be discussed today. So we start with Gerard on the cost efficiency and cost control. We have over them two speakers from Generali, with Eric covers the topic on the power of claims and claims data in identifying Medicare trends and cost drivers. Daniela Masters will speak about the power of well-being initiatives in migrating Medicare trends and cost drivers. Afterwards, we hand over to Vadim Piombo, who is the CEO of Europe Assistance in the CIS, talking about how service companies transform from cost controllers to wellness consultants. And at the end, we have Stephen Spill from Into Matrix, who will talk about the topic, never let serious crisis go waste. We will, to make it a little bit more interesting in the interactive, so we have a couple of polls during this seminar, plus we will at the end also have a Q&A session for your questions. In order to make that webinar an experience for everybody, I would like to remind you on some house rules. So we put everyone on mute. There's a possibility to speak up, mostly for our speakers. But not to disturb. I also ask the speakers not to put the mic on if they are not. It's not their turn. The second one, if you have questions, please use the chat box. We will try to answer these questions at the end in the Q&A session. And last but not least, I really ask you, because I think it makes the session more interactive, if you actively participate in the polls. Next slide, please. And many thanks for our media partners who helped us to distribute the invitation to a really wide range of interested people, not only in Russia, but also in, as far as I understand, in the CIS region and in Europe. So again, from my side, and I think also from the speakers, many thanks to these companies and chambers to help us in distributing. So with this, I would like to hand over to Gerard for the first topic. Gerard, your turn. Thank you.
Good afternoon. Thank you so much, Norman, and greetings from sunny Netherlands. Into Matrix Global Consulting, we are specialized in helping small, mid-sized, micro, nano, multinational companies to consolidate their benefits around the world and bring significant cost savings. That's what we do. Yes, we are present in Russia, in Ukraine, Kazakhstan, and some European countries. We are also a part of a global broking company called BrokersLink, and we have a presence in over 116 countries. So we have a global reach and extensive knowledge and experience, local knowledge and experience as well. Today's webinar, the title Optimization and Harmonization, is so appropriate because we are looking ways to bring cost efficiency and solutions for clients in Europe, in Russia, CIS region, and also in the eastern part of the regions as well. Coronavirus, as you know, the invisible enemy, presented us with unprecedented challenge and opportunities. It might change the way we work forever, which means new protocols, new way of working, new set of compliance and social security requirements, new health and safety needs, and of course, new sets of benefits for employees. That is the new normal. Businesses around the world is trying very hard to get a grip with what is happening and adapt to the new normal. It is now more important than ever to rethink, to reimagine, to reinvent, even to disrupt the way we organize the needs of employees' well-being while focusing on the success of the business. As you know, employees are the most important assets, not just stocks and shares and fancy buildings. And during this unprecedented, turbulent situation, it is now time more than ever to keep our employees' well-being at the top of the agenda. There are lots of uncertainties, and many are predicting economic crisis like we never witnessed before. The real impact we may witness in the second half of 2020, maybe the beginning of 2021. The reality is, we don't know the actual impact the pandemic will cause. However, we know that trillions of dollars being wiped out the stock market, even though we see some changes there. Millions got infected by coronavirus, hundreds of thousands died, hundreds of millions lost their livelihood, millions of businesses are likely to be closed as we speak, particularly the smaller enterprises. So what is happening? What happened during the lockdown? The general trend in the insurance world during the lockdown, we saw a significant increase in demand for insurance. We saw increase in premium due to potential higher risk. However, we also see a decrease in claims during the pandemic, particularly in the healthcare and mortgage insurance sectors. The majority of the claims during the pandemic were rejected because pandemic is not covered. So many are asking, what is the point of insurance if they don't cover unforeseen circumstances? Fair question, maybe. The questions are being asked, why pay the same premium when the risk exposure during a lockdown is low? So you may notice that during the last few months, we were not able to go to hospital or clinics for normal healthcare related treatments. So significant amount of the claims were rejected during the pandemic because pandemic is excluded. So the denial of the coverage, frustrating the business, creating even more uncertainty during the difficult time. So the trend is the pandemic could lead huge demand for insurance, and insurers are looking at to capitalize these opportunities. The question is, will they offer cover for pandemic-related claims? Will the insurers be more transparent when it comes to coverage and pricing? Will the insurers reinvent themselves to serve the post-corona expectations? So what can we expect post-lockdown? The world will never be the same ever again. Just as 9/11 terrorist attack changed how the world looked at the terrorism insurance, the pandemic will remain to change the way we look at the insurance. Whether it is in Africa, in Europe, in Asia, in Americas, coronavirus has done more to raise public awareness, the role of insurance, ever than before. More and more businesses and individuals seem to become more aware of the risk and the necessity for insurance. Legislations in countries are also changing to protect employees post-corona COVID-19, preparing the way to the new normal. The question is, in post-lockdown, post-pandemic, how can we have a new level of insurance cover while maintaining cost? Post-lockdown, our new level of expectation is going to be high. Cost for reaching that expectation will also be high. Question is, will it be possible to bring cost efficiency while searching for the new level of insurance post-COVID-19 insurance benefits? pre-pandemic benefits and perks you offered may not hold up post-pandemic era, because the benefits promoted a year ago may be seeing outdated, antiquated. So a key response for employers should be to examine and rebuild the benefit packages and how the benefits are funded. That's also important. The employer needs new creative benefits to retain and attract talent. For example, the remote working initiative is no longer going to be a privileged benefits offered to a few by the few. The gym membership and other health perks no longer going to be a wow factor. During lockdown, people used to doing exercise at home without gym equipment, using weight of their own body. So we need to rethink, reimagine, reinvent, even to disrupt how benefits will be offered, how the benefits will be funded. I want to talk a little bit about the multinationals. There are well over 65,000 multinationals around the world, and well over 80% of them are represented by the small, mid-size, micro, nano multinationals. Most multinational companies today are so decentralized. Local operations are run autonomously, leading to multiple benefits across different countries offering different benefits, different rates, different underwriting terms. Many multinationals today, they like to have some insight into country by country spending, more centralized control, streamlining benefits, leveraging the global scale. Also, an element of transparency, monitoring the effectiveness of the new strategy they put in place. Also, steps to keep employees healthy, the actions to increase employee engagement. That's also very important. So when you look at this particular slide, you will see these questions can be achieved through global benefit management, also known as GBM, which enables multinationals to manage employee risk benefits on a global basis centrally. Could I have the next slide, please? If you take a closer look at this slide, it shows types of options you have. Scales between 1 and 6. Scale 1 is fully insured contract. Yes, it's very popular among the multinationals, but not necessarily the most cost-effective way. If there are no claims or low claims, insurance company wins. You lost. If there are claims, an insurance company may not pay out, depending on the exclusions. And if the claims are high, they will increase the premium next year. So you lost again. So the question is this the best way to get the best out of insurance companies? Other options, when you look at 2, 3, 4, 5, and 6, it gives you more control on your spending and participating in the share of the profit. You can passively manage international pool or captives, or you can actively manage the pool and the captives. But you will see the actively managed pool and captives gives you better result. We will have a separate seminar, a webinar, by the way, on this particular subject after the vacation sometime in September. So please keep an eye on for the date and information. Can I have the next slide, please? This slide gives you a snapshot, the result if you consolidate benefits under one roof. On the left, you see, assuming the claims remains the same, by the way. So in the left, you see a pre-consolidation, and on the right, post-consolidation. What you see is that the administration costs, commissions, any of the expenses after consolidation is gone down. Most importantly, you notice the profit margin for the client increases and the very little margin for the insurance. That is on the green, and the yellow one is for the insurer's profit. Can I have the next slide, please? This slide shows a simplified version. I think you got a wrong slide there. So one before, please. Yeah, thank you. This slide shows the more simplified version of an accounting statement, which was the premium paid in around the world minus all the expenses, including administration costs, reinsurance costs, taxes, claims, etc. And the rest is returned to the client as profit. In my humble opinion, this model is what the client should be aiming for. In this model, you saw the administration expenses went down, by consolidation, imagine if you're able to reduce the claims by keeping employees healthy. Even more profit is returned to the client due to lower claims. Now, could I have the next slide, please? This is a case study. It's a real case study, actually. We deliberately chose a smaller multinational, for example, which demonstrate you don't have to be big to reap rewards. In this scenario, the clients are in 11 countries in Europe. They had certain conditions, requirements to roll out benefits similar to what they offer in the UK. If they had bought benefits country by country, it would have cost them in over €500,000. We implemented a cover in line with their expectations, streamlined and centralized the whole process, removing hassle and stress from the local HR professionals, save them over 30%. Later on, we looked at the claims, actually managed the claims. We brought the claims down and we reduced the premium even further by 20%. So the savings from this kind of initiative can be significant, which could be brought back to the client and fund towards enhancing benefits within your organization for the employees, and also investing towards the skill developments as well, which is very important. Next slide, please. To conclude, I want to leave with a bit of food for thought, if you like. Tempting it may be seem to continue to evaluate group benefits as you've done before in the past. It is best to sit down and methodically review the whole benefit strategy, review how the insurance is sourced. Cheap is not the best. Adjust the benefits designed to your new business model. Ask your insurer to be open, transparent with their pricing and claims data. You need facts and figures to substantiate for the rate you pay. I understand many insurers may be reluctant to share actual claim details, but I think if many of you ask repeatedly, they will give you claims data. This could be the opportunity to make sure you are insuring your business to the best of their ability and reduce cost. Employees will remember the actions employer took during pandemic to keep them safe. That legacy will be remembered. If your legacy is not a good one, you're likely to lose these good people when the market becomes more stable. For cost efficiency point of view, ensure your employees are healthy. Happy, healthy employees increase productivity and less claims, which results in lower cost to insurance. Thank you very much for your time indeed. Please keep safe, keep healthy. Thank you.
Thank you, Gerard, for this first topic, and really interesting. And I think it was really nice, the closing words, especially now with this COVID, the new reality we live in. It's really the time like to think about what can be changed, how can we ensure, or let's say, rework the benefits to the new reality. So we have a little small, the first poll for you in the audience. So would like to start this poll quickly. So can you answer, Chrissy, the question, which benefits would you value most in the global benefit solution? That the cost savings, which Gerard mentioned, could be up to, in the example, like 24 to 30%. A central control and oversight of the contract, which gives you a complete and a new way of managing this contract, a new level of transparency. You see how much you spend, how much you get back. And it's also important, as you like running operations in several countries, having the same benefits for your employees across countries, which is in a matter of diversity. So I kindly ask you to participate and quickly vote. So we wait a couple of seconds, and then Agnesa, please, and Christina, show the results. Okay, the results we didn't see. I think we put on then later on. So then now I would like to hand over to Eric Butler from Generali Employee Benefit Network, who talks about, I think, a really interesting topic and often, let's say, a topic not well discussed in the industry with the clients is the power of the claims data. Eric, to you.
Thank you very much, Norman. Good afternoon to everyone. It's a pleasure to be here with you all. Just to follow up with Gerard said, during the COVID crisis, I think there's an increased appreciation by most employers about the importance of the health of their own employees, as well as the value of healthcare coverage, making sure that their employees are taken care of, despite the fact that during the COVID coverage, many of their employees couldn't access some of the healthcare coverage to the private sector that they intended to do. But thinking long term, most of the employers that we work with through the JEB Global Employee Benefits Network is the multinational clients are focused on how best to make sure that their employees are healthy, knowing that one of the reasons for a bad outcome in the COVID crisis is actually an underlying unhealthy state for their employees, but also preparing for enhancing or improving access to healthcare once this is over, to make sure that the private coverage that they have access to is strong, it's clear, they know how to use it, and it's a very good care they have access to. But they're also very concerned about the costs associated with it. It's one of the fastest growing areas of employee benefits, private medical insurance, but the costs are something that give pause to many in multinational companies, knowing that the costs go up every year in a way that other employee benefits do not. If you would go to the next slide, please. The reason for the costs have gone, let me just, I'm sorry, can you see my slide? There we go. So the reason for the costs going up every year on healthcare costs and insurance comes down to something called medical trend, by and large, on a large level. And medical trend is a concept that in the insurance business we understand is to be the change year over year in overall healthcare costs. A lot of people mistakenly refer to it as inflation. We're not talking about inflation. Inflation is the year-over-year change of specific unit costs. Say the cost of a consultation that costs 100 euros and then goes up to 105 over the next year, and that might be a 5% inflation. Inflation can contribute to it, but medical trend is often 2 to 3 times what the general inflation is in a country. And medical trend can be influenced by changing in the aging population with new diseases that they have, new technologies that come into play to treat certain issues, new technologies that might actually be available in the private sector. Same thing about patient demand, where people start asking for certain types of treatment that they didn't before, or providers that suddenly start practicing in a certain way. And in the private world, a big shift away from the public sector into the private world. Those are all reasons for a change in the costs. But the biggest reason is a change in the burden of illness. And the burden of illness is what types of diseases we're seeing out there. And I just want to show you what we have here, some medical trend estimates by 3 of the global brokers that produce a survey on medical trends from A.N. Mercer and Willis. And you can see, looking at the G7 and the E7 countries, Russia, as you can see right there, is the medical trend estimates for 2020 are about 2 to 3 times what the general inflation is are for Russia. These are something that we see over and over and are of great concern to the multinational clients in maintaining this. At the same time, they see the value of the insurance. So the change in the burden of illness, if you go to the next slide, is related to primarily a change in what types of diseases we see. And the biggest story of the last several decades is the rise of non-communicable diseases. Our grandparents were mostly concerned about accidents or certain diseases they would catch. A coronavirus is something that is a communicable disease, something you catch from someone else. But there's been a huge rise around the world of non-communicable diseases, mostly because of lifestyle. We're sedentary, we're gaining weight, we're living in a way that actually makes us less healthy. And just to prove the point, right in front of you are a couple of pie graphs that show you the number of deaths. This comes from World Health Organization. The number of deaths in 2017, of the 58 million deaths that were recorded, 40 million of them are related to non-communicable diseases, over 71% of those. And of those, about 38 of them were considered premature, which means that they were deaths that were related to 30 to 69-year-olds. So we would expect someone to die after a certain age bracket, but the premature ones, as a very large percentage of that group that was premature. And of those premature deaths, those 30 to 69-year-olds, 80% of those came from 4 specific diseases. And they were all of the ones that are related to lifestyle. So we're looking at diabetes, we're looking at cardiovascular diseases, we're looking at problems that are associated with lifestyle. And they're all associated with certain behavioral risk, which is tobacco, physical inactivity, alcohol use, bad diets, as well as metabolic, or how your body is. And that's high blood pressure, being overweight, hyperglycemia, and hyperlipidemia, which is fats in the bloodstream as well as sugars in the bloodstream. These are the concerns we have now on rising healthcare costs, as more and more of the population is moving into these categories, and many of them uncontrollable. I'll point out that these are the very same issues that are driving some of the bad outcomes on the COVID crisis, making people more at higher risk. If you go to the next slide, please. So a lot of the corporations before the trend knew that they were trying to focus on this, and there has been an increase in trying to act upon that, to try to do something to mitigate what sort of issues their employees have, and as well as the health insurers locally, trying to make sure that they could bend the trend. And by doing that, they're trying to figure out a way to be involved and try to get people to be less sick, or to not get sick, change their lifestyles, not develop certain diseases, or to manage their disease a little bit better. This is actually a really interesting graph that looks at a projection of a large multinational client looking on a static population of their global healthcare trend. If they did nothing and they just saw a 10% increase in their healthcare costs because of medical trend, which is sort of a generic global trend factor, over these years, and going from 2015 to 2025, going from 90 million to 238 million euros a year. And that's just at a compounded rate of 10%. And what they realized is that that was not sustainable, and that they felt that they couldn't just rely on the insurers to do something, but they themselves needed to be involved. And so they actually projected about having a shadow experience by bending the trend. They know they couldn't eliminate it altogether. They're also acutely aware that some of those communicable diseases are ones that take a lifetime to develop. So you couldn't do something today necessarily and save money today for some of these healthcare issues. You might be spending money today to avoid costs years down the road. But they looked at how they might be able to bend that trend. And then the other thing is working with their insurance company to try to do that. This is all about controlling costs. But the problem with this is they also realize is that it's difficult to figure out where to spend your money onto this so that you actually engineer a program that's appropriate to get the maximum. You need a mixture of what can you impact today as well as what you can impact going forward. This has never been more important than during or after the COVID crisis, as companies realize they need private health insurance, but in a much more difficult economic and financial world, that they need to make sure they're offering the coverage, but they can't, they have to really control those costs. So there's an increased need to actually manage the costs that turn these claims that turn into premium, but also really have an impact on the healthcare of their employees. If you could turn to the next slide, please. So the way to do that is through medical reports. And Gerard talked about asking for data from your insurer, and you absolutely need to do that. The best insurers provide data to companies to figure out what's going on. And the type of data you have, it's not raw claims data. There's a lot of GDPR issues that prohibit you from doing that, but it's summarizing that data on an anonymized basis and then sorting that data through a series of filters so that you can easily see what's driving the cost. So you're looking at high-level KPIs to understand if, is it more people being sick, or are they consuming more services? Is the average cost going up? Focusing on large claims, which are expensive services, or high claimants, which are people with comorbidities. Trying to find out if the problem is employee-based or dependent-based. Looking at different age bands and gender to see if a solution might be more targeted to them. Focusing particularly on your benefit categories. Is the problem really an inpatient one, hospitalization, or is it related to an outpatient benefit or maternity or dental? And then even go to the subcategories. It could be the outpatient's concern, but really it's consultations and diagnostic tests. And looking at the diagnoses, looking at broader ones, not looking at individual codes, but trying to see, is the problem respiratory related or musculoskeletal related, or is it circulatory basis? Because there could be a variety of illnesses that are different codes, but all relate to the same sort of problem. And then looking at the chapters and subchapters associated with that, but also looking at your provider network. Where are people being treated? Do we need to maybe do something about that? And then comparing your experience with someone else. These are ways of slicing the data to give you insight, and always trying to understand the year-over-year changes to see what's driving those costs. Where do you spend the most money? What's going up? And understanding the root causes, whether or not it's based upon more people, which is incidence, so you might want to try to get people to not get sick in that area or use that service. Frequency, which would be claims per claimant, that's just the number of services they use, or the average unit cost to address. That's how you figure out what to engineer for your solution. And by doing that, you learn something. And let me give you just a quick example that Danielle is going to go in. If you change to the next slide, please. We have a client that was focusing on their healthcare costs in Thailand and having large increases year over year. And they were focusing on national issues, which are diabetes and cardiovascular disease, as well as some problems with digestive issues due to bad water. But actually studying the data for this population, we realized that almost a quarter of the total paid claims were respiratory related. And of those, they were overwhelmingly related to flu and pneumonia. And they were actually related to inpatient claims because there was very little that was outpatient covered. So it was strongly inpatient. When we studied that, we actually realized that 86% of those inpatient claims were related for flu and pneumonia, and specifically for 20-year-olds, 20 and under. So these are children being admitted, despite the fact that the children, a very small percentage of the covered benefit was mostly for employees. And when we looked at that, so we could look at flu being 5% of all claims paid, and 60% of those inpatient claims were by children, a third of the outpatient, and pneumonia was also 3% of total paid, looking at 77%. So rather than focusing as an employer on maybe employee issues, they need to look at dependent issues, and specifically respiratory illnesses and flu and pneumonia that they had never focused on before. So they wouldn't maybe stop working on cardiovascular diseases, but really focusing a little bit more on a population that you could actually impact in the short term if we knew how to address that. And then lastly, studying which providers, they were exclusively being admitted to very inexpensive hospitals. And we were discovering that those inexpensive hospitals was because they had very little outpatient benefit, and we're not sure if the treatment was going to be covered with that. And so this is sort of an eye-opener for the client to see what their issues were when they thought as an employer they needed to focus on diabetes and all the other classical ones that we're focused on. And it gave them the opportunity to think, what can I do as an employer, myself, and with my partner insurance company to mitigate these trends? And with that, I'm going to turn it over to Daniela Masters. But before that, I think we have a survey to do.
Yeah, thanks, Eric. So I would ask then quickly to have the survey before we. Yeah, so we had quickly a quick poll. On it be interesting if your company is currently reviewing medical claims data on a regular basis. An easy question: yes, no, or I don't know. So I think we wait like a couple of seconds, and then I ask the colleagues to show the results. Can we show the results, please? All right, which is good. So we have more than 56% of people like getting data, looking into this one. But I think you see we have around like 44% either don't know or they don't get it. So thank you very much. Now we head over to Daniela Masters with the topic of the power of well-being initiatives in mitigating Medicare trends and cost drivers. Daniela, please to you. Can we start the slides, please?
Thank you very much. Yeah. I'm just going to show my screen now. I hope you can all see my screen now. Yeah, is everything okay?
Yes.
Yes.
Okay, perfect. So thank you very much for that segue with the poll about medical claims data, because this is really important, and to really use the data in addressing it and mitigating the trend. Gerard has mentioned this at the beginning, that a lot of organizations ask for a more central approach to health and wellness, and we as Generali Employee Benefits Network believe that especially because we're working with pools and captives, and as we heard in Gerard's presentation, they might have a bigger interest in managing their claims because they can get a higher profit out of it. It is very important to use that data. And why medical is a really important one, and the medical claims that we can study is a very important one, is where I want to dive in. So it's good to hear that about half of you who are joining this webinar already use medical claims data, but hopefully we can address that the rest of you is doing it as well. So one of the reasons why medical matters is that it is definitely one of the most valued benefits that we have in the employee benefits space. So studies have shown that the private medical benefit is definitely the one most valued, and there's the highest correlation between employee satisfaction and health insurance. So it is very important for talent recruitment and retention. There is definitely also a direct impact on the bottom line. You see some stats here around how much money illness-related absences cost, and mental health, stress and mental health is a huge factor in lost productivity. So there's a direct impact on the bottom line, and a healthy workforce shows less absenteeism and improved productivity. It is also very important from a financial point of view to manage medical claims in particular, because the medical trend, as Eric mentioned earlier, is 3 to 5 times the general inflation. And in addition to that, medical claims is actually an area that we can actually have an impact on, other than life insurance, for example, where we don't have as much engagement and interact with the members. So we believe at JEB that employers and insurers need to work in a partnership to bend the trend together, which can then have an impact on the claims data and directly impact the premium paid. We believe that it's very, very important to use the data that you have available to make informed decision on health and well-being programs to mitigate those trends and cost drivers, and to find intelligently engineered programs that make sense for the local market conditions. It's also important to review locally that the cover is relevant and appropriate. There's we've heard earlier, there is definitely differences in scope of cover in each country. So our approach at Generali Employee Benefits Network is a holistic approach. We recommend to our clients to take a holistic approach to managing the costs in the private medical insurance, and to improve the quality of care and access to care for the employees. We first do that, as Eric showed you earlier, by collecting and analyzing the data. We really want to understand the trends and cost drivers. We also want to assess the design of the local medical benefit. Is there maybe potential for improving the plan efficiencies, such as reconsider the scope of cover? We just had the example of Thailand, where we heard there's mainly inpatient cover. Is there maybe room for improvement there? We also want to reduce costs. So is there maybe opportunities in the plan design to have member cost share components or medical provider network amendments? And then lastly, and this is kind of where we're going into the mitigation ideas, can we find targeted and relevant well-being programs to address these trends and cost drivers? And at JEB, we believe in 3 missions of health and well-being programs. One is staying healthy. return to health, and manage chronic illness. So primary prevention, secondary prevention, and then the management of chronic illnesses. So at this point, I wanted to ask for the poll to come. So the poll is, how much value do you currently derive from the data that you receive? So can we see the results? Can we see the results of the poll?
Yeah, I think we have, I'm not sure if they can see it. I can see it. So we have actually like around 50% of people said that medical claims reports they're using at the moment, and then 42% said we're using employee engagement surveys. So that's actually most of the people are using these tools, nearly all, and we have a little bit like 8% using health risk assessment data. No one seems to use EAP reports and participation reports. So back to you, Daniela, for the slides.
Thank you very much. Well, this is very interesting because there's a wealth of data out there that we can use to make informed decisions on health and well-being programs. So it's very interesting that some of the reports that are frequently used, especially when it comes to mental health, which I believe is a very important one to support during the coronavirus crisis, that this data is not necessarily used. So maybe food for thought for those who are listening in today. What other areas of data they could use to address trends and cost drivers? So going back to the example that Eric shared earlier for Thailand, for one of our clients, I want to draw your attention to some of the key areas that he pointed out. We saw that flu and pneumonia represented 37% of the total respiratory claims, and mainly in the inpatient setting. We also understood from the analysis that it was mainly incurred by children. So children, compared to the employees, were actually the main drivers for the costs. And then we also heard that they were mainly in low-cost hospitals. So going back to this case study, we might want to think about how can we address this. And I've just put a few ideas on the next page, which either address the target incidence, so how many claimants do we actually get, the frequency, or the unit costs. So in this case, we worked with the clients to identify that it would potentially make sense to organize a family health day, this was before lockdown times, to emphasize child vaccinations, so for flu and pneumonia, because we saw that not only flu was a problem, but pneumonia as well. And we also made a comparison between the costs of a pneumonia case compared to what the cost of the vaccination is, which definitely turns out to be more cost effective to prevent the case. Education awareness campaigns at work, but also find a way to educate the families at home, because obviously they do need the prevention measures too. Respiratory illnesses are always also in relation to the work environment, work health and safety. So do we need to assess the air filtration system to improve air quality? And one point that is very important, especially in the Asian region, and we're in Thailand here, is to review HR policies. A lot of HR policies for absenteeism include a one-day absence. So there is one point, but in this case, we also wanted to make sure that there's an HR policy in place for caring parents. So do they have to, is there any way of making the work arrangement more flexible if a parent has a dependent sick child at home. For the unit costs, to address the unit costs, is there a way of pre-authorizing or a triage service for respiratory illnesses so we can actually prevent people from going to the hospital in the first place if it's not necessary? We haven't mentioned this actually yet, which is a point that is in high demand at the moment in the coronavirus crisis for telemedicine. Exclude low-cost hospitals for specific conditions, definitely a more drastic kind of approach. And then the last one is member cost share component within the plan design. Do we maybe have an out-of-pocket component for employees to participate, to put into the treatment costs when they go to hospital? I have one quick other example that I wanted to show because I realized that that Thailand might not necessarily be too relevant to those listening in. I have prepared an example for Russia. Russia doesn't report on all the areas that we normally cover in our reports, but it's still really interested to have a look at the data that we have and identify areas to work on. So here's a case study for Russia and respiratory illnesses. And we saw that 9% of all claims paid were again for respiratory illnesses, and 90% of these claims were actually for acute upper respiratory illnesses. So diseases that a doctor not necessarily can do much about other than telling you stay at home, rest, and drink chicken soup. So we also saw in terms of the population that it was mainly employees that we're seeing claiming for these issues. And we also saw that 24%, so almost a quarter of all these upper respiratory claims were coming from one specific clinic group. So these are very interesting discoveries in the medical claims data that we can actually do something about. So as an example of what could be put in place to mitigate these trends and cost drivers, we could again educate. We can review the absence policy. Oftentimes from experience, when we do see respiratory illnesses as one of the main drivers in the cost, we ask the organization if they have a one-day absence policy for a doctor certificate in place, which is especially, as I mentioned earlier, is the case in the Asian region. The air filtration system is again a problem, something to review. Do we need more frequent sanitation of office facilities? I believe under the COVID measurements that are put into place, this is something that will have a lot of relevance for most organizations who bring their people back to work, as well as provision of hand sanitizing gel to prevent the spread of respiratory illnesses in general. And as we saw, the claims came from one particular clinic chain. So it's definitely a question of frequency. Can we review if the provider encouraged potentially unnecessary repeat visits? Is there a potential to negotiate pricing for care in this identified clinic chain? And is there, again, the opportunity to bring pre-authorization or triage in place and have a member cost share component? So even with the more limited data that we have on the Russia experience, there is still a lot of potential to address these trends and cost drivers that are potentially not only related to the traditional health and well-being initiatives, but also more on the plan design and plan management. And with that, I'm going to pass it back, and thank you for listening.
Many thanks, Daniela. It was really insightful, especially I think I like the Russian example, and I think we come back to this maybe I think in the Q&A, because I personally have a question to this, but I think our audience also. So now I would like then in a matter of time quickly to hand over to Vadim from Europe Assistance, who will tell us a little bit more from the transformation of service companies from a pure cost controller to a well-being consultant. Vadim, it's your turn. Thank you.
Thank you very much. I hope that my screen is clearly visible. So Europa Assistance is a service company in Russia, established in 2001. We are an international company specializing in services related to the medical services, with the headquarters in Paris, and we belong to the Generali Assicurazioni Generali. Today we have to speak, and Daniela already anticipated some of the things that are important in the voluntary medical insurance. And as service company, we are
Vadim, sorry. Can you? We have a little bit issues to understand you. Can you please move a little bit closer to the mic, because otherwise the audience is not able to listen to you.
Okay. Can you hear me?
Yeah, now it's better. A little bit closer. That would be great.
I'm sorry. If there are problems, please advise. So, as I said, service companies are going to have a different role from pure cost controllers to well-being consultants. Few words about what each stakeholder expects from the voluntary medical insurance. The insurance companies are, of course, expecting to have an optimization of the costs, develop the access to the medical facilities, have a good loss ratio, and avoid any complaints of the employees of the organization that they are insuring. The company that is buying VMI essentially is using it as a motivational factor to keep loyalty and high loyalty to the company of the employees, so it's a mean to have them satisfied, and at the same time to try to keep the insurance premiums stable. The medical facility wants volume and to be paid as soon as possible. The employee, that is the key here, wants to have the access to the best facilities, doesn't care about the cost, and essentially wants to have as much as possible free. So, as you can see, there are different priorities that in some cases are overlapping and in some cases are conflicting. So, building a balance among all these needs is one of the tasks of the service company, based on a constant communication among all the players in order to face and react timely to the new expectation and provide a high quality of service. So, as I said, VMI is a way to increase loyalty and productivity. Loyalty because everybody in Russia is expecting to have a coverage within their work contract. And then, in the same time, data are showing that in 2018, the Russian economy lost more than 200 billion ruble due to the workforce illness. So there is a huge space in working on increasing productivity, so reducing, let's say, costs, and increase with added services the value added to the voluntary medical insurance as a benefit. Clearly, you cannot avoid to mention what is happening with the COVID-19 and how this is impacting. Of course, it's impacting the way we are behaving.
Vadim, is it possible to quickly move to like a headset? Because I think it's difficult to understand you because you're on and off, or really stay really close to the mic, because otherwise it's really difficult to follow.
I try to sorry for that. Now can you hear me?
Yes, a little better, but I think can you stay please close to the mic as possible, because otherwise
I have the laptop in my mouth practically. just a second. Let's see if I can better. Can you hear me better now?
Yeah. Thank you.
Okay. I'm sorry for that. Technology, you see, this is putting a pressure on me, and this is something that I was saying. It's fine now, Norman.
Yes, much better. Thank you.
Okay, that's great. So, as I was saying, the COVID-19 is changing our behaviors and it's having an impact, and we cannot speak about VMI without mentioning this. We are working from home, having fears for the future, so this is impacting our psychological stability as well, and even the way we are ready, or employees or whoever is ready to access to medical facilities are changing. Not only because the medical facilities sometimes cannot accept you because of the COVID, so they are overwhelmed, but because we are starting to have fear to go to the medical facility. So the trend is an increased request of digital solution in communication with the doctors and having support from the medical facility. In the meantime, besides the COVID and this situation that we hope will evolve and close as quick as possible, there is the normal evolving needs of the society, and the employees, as all of us, we are evolving with the society. So the society is more and more asking us to be aware about our lifestyle, the attitudes that influence our health. We are constantly receiving information, what to do, not to do, what to drink, what to have as exercise, how much to exercise. So all needs are evolving in new expectations, and other are new are coming out. So like critical illness, or having a second medical opinion, or having a coaching. So if we want to name this game, I would say that the employees are looking for a medical concierge more than just an insurance. So what is the new role of the service company in this case? We see three elements in supporting the employee. First, of course, is manage his or her health problem, consulting in well-being, and preserve the medical balance. What does it mean in practice? Managing the health problem means, of course, to provide the medical support when it's needed, but as Daniela mentioned, you are not having the access to the medical support, and then that's it. You can have temporary invalidity. You need to be prepared to the surgery or after the surgery. So a certain level of services, ancillary services during these periods are one of the new requests from the employees. Well-being means, of course, to preserve the health of the employees, preventing their illness, in doing and providing them useful information. Daniela mentioned the vaccination and so forth. And of course, the message has to be tailored, because the employee population within the same organization can be different, is different, and have different needs. So a designed onboarding that can allow to correctly profile these needs is important in order to give a tailored message. Mental balance means, of course, beside the classic hotline for psychological consultation, let's say, is to help in relieving the employee during when he's or she's facing the daily problems, for example, connected to the pandemic. We are now home working, and we know that children as school not always based at school but at home. And when they finish, you are working from home and you have to take care of your children. So some cases, school coaching or support in these can help the employee to approach his work better and to be more, let's say, in a peace of mind toward what he is doing. So in summary, I think that just to satisfy the needs of receiving medical treatment is not enough anymore, because employees are more and more demanding in their work packages. They would like to see assistance services, professional coaching in terms of health advices, one-on-one specialist advices on specific questions or behaviors. So dealing with even their daily problems related to health and relieve the employees in or solving part of these problems is another way to support them during difficult periods. So to conclude, a real effective health plan is a result of understanding who is your employee population with specific questionnaires or onboarding, and tailor a specific approach and not, let's say, one size fits all. So in short, this is my conclusion, and as Gerald said, stay healthy and be careful because the time is evolving in a positive way, but we are not out of this COVID, unfortunately. Thank you very much.
Okay, thank you very much, Vadim. And apologize, I think we had issues a little bit on the technique, but I think Vadim managed quite good. So we have like two little and short polls, which are quickly asked to start on the topic of Vadim. So question is, do you have currently a wellness offering in your Medicare program? Yes or no? I think we give like 2-3 seconds to show the results. Can we have the results? Or so it's like kind of 56% don't have, but we see a lot of people already have. And the second question, please. So do you expect from your employees will request the wellness program to be included in the program, Medicare program, especially after COVID-19? So yes or no? I think we also give like 2-3 seconds. I think it's a quick question. So can we have please the results?
Norman, if you can take back the sharing, because I cannot see until you take out.
Yes, but we share this later on. Unfortunately, I think you're on the presenter mode. You cannot, but I can tell you the results of the second question is around 82% of the people expect that wellness will be like a topic in the future, especially after COVID-19. So we run a little bit behind time, so I ask the participants a little bit to hang on. We have, I think, a really interesting topic at the end from Stephen Spill, who is in the board of advisor for Into Matrix, and the topic is never let a good crisis go to waste. Stephen, to you.
Okay, thank you. Good afternoon. I hope you can all hear me well. It's very interesting listening to colleagues earlier talking about the private healthcare offerings. I've just been on a call with a board that I'm a member of, which directs one of the big health service operations here in Britain. We have about £1 billion budget a year, and we basically nationalised all the private hospitals and clinics for the duration of the COVID crisis. So any private medical care you want here now you can't have, but that's obviously only very temporary, and it's not what I'm here to talk about. So if I could have the next slide, please. So the saying, never let a good crisis go to waste, was originally attributed to Winston Churchill, wartime Prime Minister in the UK, borrowed more recently by Rahm Emanuel, who was Barack Obama's Chief of Staff and a mayor of Chicago. And, you know, it's too early at the moment to assess all the implications of the COVID-19 crisis, but there are some ideas that are based on current thinking and experience of previous crises that we can talk about. And I was around during the aftermath of the financial crisis in 2009-10, also the 9/11 crisis that Gerard alluded to earlier. So the first thing is to focus on the positive. And the first one, we've seen it, we are seeing it now, the use of technology. It's a bit obvious, but everybody is now working differently and with technology. And this is something which is going to change for the better all of our working experiences. We have to develop new management styles. Remote management needs whole different styles and skills. You might be good at managing around the water fountain or around the coffee machine. It's very different managing people that you might not see for months on end, and in some cases you may not even have met yet because you've hired them remotely and you've inducted them remotely. You need now to have a flexible workforce. Our workforces were becoming more flexible, more mobile anyway, but this has now become the absolute normal. The old contracts will be things of the past. In the past, you used to hire somebody because they lived in your city and they were good, or you would hire them because they were good and invite them to come and live in your city. Now you can hire them wherever they are. You might say, look, Stephen Spill looks like a good guy. I'll hire him. He's living in a farm in South Wales. We want him to work for us here in Moscow, but it can be done. He can fly over once a quarter, and the rest of the time he can work wherever he wants to work. This is what your new recruits will be expecting from you. You can take out a lot of cost, establishment costs, offices, etc., travel costs. These scope for reduction there across the board. Speed of decision is very interesting. I don't know if you've worked with old board structures where you would bring an idea to a board and the board might like it and they'd say, well, could you go away and change it a bit, but the next board meeting's not for 3 months. So you have an idea, you wait for the board meeting, you develop that, and 6 months down the line you might get a decision. Now decisions are being made instantly and through technology, but through the sheer fact that people have had to move quickly. And we're not going to go back to the old processes, I'm sure of it. And customer satisfaction, very important thing to focus on, because the clients are impressed with you. They see what you've done during this crisis, so you've done well, and they'll be impressed with you and they will buy more. So moving on to the second point there on the next slide, which is already in vision. We're all in this together. No, sorry, back to that one. Thank you. You have to keep talking to colleagues. They're remote, as Vadim said earlier. They're feeling a little bit isolated. So you've got to make them feel part of your team, make them feel needed, give them the security that you want to give them. It may be that there will be cost pressures, and it may be that you'll have to reduce numbers, but you can do it in a fair way so that people don't feel they've been hard done by. What we did in my previous firm back in 2008-09 was we decided we had to reduce staff costs by 20%. So instead of firing basically 20% of the people, we asked everybody, including the top management, to basically take a 20% cut. So go on to a 4-day week. And that was all formalized, and people went on to a 4-day week, and people were happy because they still had their jobs and they appreciated the reasons, which were explained very nicely. They stayed on the team and they came back stronger once the immediate crisis was over. If you do have to cut numbers, do it fairly. The team that remains will see that you've done it fairly, and they will appreciate that because their old friends have been treated well. But you'll also end up with a stronger team. It will be a smaller team, but it will be a stronger one. I've been talking to a friend of mine who runs a big business here in the UK. He's had to cut 30% of his workforce, but he says what's left over is much stronger, keener, and will be more efficient. And for those of you in the employee benefits business, you know, because your clients will be looking at different ways of working, they're going to be looking at, as we've heard earlier in the presentation, they're going to be looking at more flexible benefit systems, so you can throw away the old contracts and the old ideas. Point 3, decarbonisation. If green was part of your strategy, do it now, don't wait. If it was not part of the strategy, do it now anyway. It has to come. And governments around Europe, in fact around the world, will support green initiatives. They're all talking about a green recovery. There'll be incentives for decarbonisation and other green initiatives. Your employees will be impressed. Your customers will be impressed. Increasingly, your customers are asking you, I'm sure, about decarbonisation and your agenda, your part in that agenda. And your recruits, you know, the young people, they're not so much asking about how much they're being paid. They're asking about how much free time they'll have and what your decarbonisation agenda is. And as I said before, maximize the current customer goodwill. They're impressed with what you've done. They're impressed with the different ways that you're working, and they'll be willing to come back to you and buy more from you. And the next slide, please. So the next time, and there will be a next time, we've come through this COVID together. We are coming through it, some stronger than others, but we have to be ready for the next time. It may not be another pandemic, it may be something else, but there'll be another emergency. So the key things to learn from what we have learned from COVID, act swiftly, but have a plan that informs your decision making. Some of the countries that have responded best to the outbreak, like Mongolia and Taiwan, they'd seen the thing before. They'd had a pandemic like this before. They knew how to approach it. They already had a plan. And companies should operate in the same way. They should have an opportunity to look at their business continuity and crisis plans carefully and build that awareness across the whole organization. It's no good just the board knowing what the plan is. Everybody in the organization has to know what the plan is when the inevitable crisis comes. So you're planning for the unexpected. It's going to be different, and because it's going to be different, you have to be flexible, ready to come. Your plan needs to be such that you can be resilient to any sort of attack. You need a crisis communication team to be in place. They need to be regularly drilled. It shouldn't be a team that's put together because there's an emergency, or put together now and forgotten about for the next 2 years until the next one. They should be drilled regularly, and they should be ready, and it should be across the whole organization, all the stakeholders, employees, business partners, regulators, customers, they all have to be involved in it. Roles have to be understood, and the key spokespeople thoroughly trained. Keep on testing it, keep on simulating it. Look at your supply chain. You know, you've seen that with long, complex supply chains, it's been difficult initially to manage ourselves through this crisis. Look at where your key weaknesses are in the supply chain and make sure they're stronger. I think work with experts. Some companies have found that there are some great experts out there who are very strong on business continuity planning and implementation. These are specialist jobs. General managers can't do it. So get expert consulting support behind you. And as I said at the beginning, get digitalized, get more digitalized than you already are, because that is going to be the future. So the companies that are going to do well are those that have resilience built into their DNA. They have the ability to react quickly and decisively to change, and to be able to recover quickly from a disaster. And that is going to be central to long-term sustainability. And that could be an unexpected COVID-19 dividend. It's been a disaster for many people, countries, economies, but as Churchill said, don't waste this crisis. The dividend is there if we want to grasp it. Thank you very much for listening.
Many thanks, Stephen. So it's really interesting topic, and especially when we're looking backwards in the history, I think it seemed that like a pandemic or like a bigger kind of virus hit this world like every 15 to 20 years. So let's see, let's say in the future, who made their homework, who had did their lessons learned and got stronger out of this. So in the view of time, I propose we answer first of all, thanks to the audience for the questions. So I will pick up 2 to 3 questions from the audience and will ask our speaker. So the first question is about technology. So maybe the colleagues from Generali can answer this. Is there like a kind of a technology companies are using to manage cross-country benefits, or how is it done?
I'm sorry, can you repeat the question about
the question was, what kind of technology is used to manage cross-country benefit management?
So I think there's different types of technology. One is the technology on the reporting side that we talked about to understand the drivers. But then there's increasingly technology related to managing access to care and also wellness. And Danielle is very involved on a lot of the digital tools that are now increasingly becoming available. Danielle, why don't you talk about what's being available there?
Yeah, so currently what we've seen working with our multinational clients is that there was an increased demand in a global approach to, for example, telemedicine. A lot of organizations have a strategy that is global when it comes to health and well-being, but oftentimes the program is actually managed locally. So a lot of local entities and HR departments of those companies also had local solutions to address certain things. So I've seen definitely a bigger demand in addressing these trends on a global basis, and therefore looking for global employee assistance program provider, looking for global organizations, digital solutions that can address mental health risk management, global solutions for telemedicine, and there is really good partners out there. We have partnered with a few that can be seen on our website. So if there's a demand or a desire from organizations to find global solutions for these kind of add-on services, there are definitely solutions out there. And if you're interested in that, maybe hop on our website and have a look who we are partnering with. There's only a handful of them who really have like a global reach. So I guess these are the three main areas that I've seen that have been demanded more: telemedicine, EAP, and mental health risk management.
Thank you. And I remember, let's say, from the results from the second to the third poll, and I think there's a lot of people out there who don't even get data at the moment. So I think like having at least like a consistent report over all the entities with the benefits and the claims and so on, I think that's already like a big step forward to what we see at the moment. So the second question I have goes in a similar direction for Russia. The question I think goes to Gerard is, with all the benefits we see of managing like the global benefit management, question comes from the audience is, why is that not that used in Russia at the moment? So can you maybe a little bit elaborate on this, Gerard? Thank you.
Norman, can it be a little bit more specific what they want me to comment on?
No, the question is like, is this like this global benefit management, is this a standard solution on the Russian market, or is this still kind of an individual solution for some of the industries?
Yeah, I'm afraid when it comes to Russia, CIS, the GBM, the global benefit management is so underused. And that's one of the reasons we want to look at ways to bring awareness to the market. There is an option. There is another option, and that generally the trend is to go country by country. If Russia tend to be the biggest part when they come to the employee numbers. When you look at other part of the regions, tend to be smaller, and you don't need to be global. You really don't need to be global, including the Western Europe or the Americas or any other regions. We can simply create a GBM within the CIS region using Russia, Ukraine, Kazakhstan, Georgia, Armenia, Azerbaijan, all these regions. So it's big enough. You don't have to be big to go global. That's the message. Hope that answers the question.
Yeah, thank you. And there's another question goes to Daniela. I hope you can answer this. It's because you had on your slide, there was, especially for the example in Russia, so there was a couple of suggested initiatives to bring down the risk. There's a question from the audience saying, okay, what would you, like, based on the data you see and maybe the research you did in generally, what would be like the 2 to 3 recommendations you give for people like working from home? Because the slide was mostly for what can companies do, but what can every employee do himself to be better prepared from home?
So I think definitely mental health is one of the most important ones to manage at the moment. We have seen in the data that I showed as well, which is, by the way, something that we don't see in our medical claims data, because mental health is explicitly excluded from the private medical in most countries around the world. So it's not necessarily something that we see in the claims, but we know that it is important for organizations to address, and especially in the COVID-19 crisis, it is one to support. We all have to amend, we all have to adjust to a new working environment. So supporting your employees with their mental health is one of the most important things at the moment. I also think that organizations, and depending on where you are, sometimes the national healthcare system has telemedicine in place. So if you're based out of the UK, Gerard mentioned that in his presentation that there was a decrease in usage of services, but also there would not necessarily an equivalent increase in use of telemedicine. So in the UK, we have telemedicine available through the national healthcare system, which has been used more, but not in the same way as a face-to-face consultation would have been achieved. So get your support, get your care, even if the delivery method might be different than you're used to. So I think these are the two really important things. Get care if you need it, and look after your mental health.
I think we do like 2 more questions, and then I think we wrap it up. One question goes to, I think, Gerard, especially on the global benefit management. There's a question like for companies operating in different countries, and they said the question is, how can you ensure that the employee is getting the same kind of benefit or similar benefit while operating like in different markets where some of the benefits maybe cannot be provided?
Correct. Correct. That is absolutely correct. In not all countries you can roll out benefits like we showed in the example. Okay, there are various limitations there in terms of the local practices. So when you do that, you need to look in what is offered country by country. There could be some tax related issues. You must address that. It is not an automatic you can roll it out. Where it is not possible, you will follow the local practice, country by country practice, and you follow the legislation. You follow what is done by your competitors as well. I'm afraid that's the only way we can do it. Where it is not possible roll out, do whatever best as possible. But it doesn't mean you shouldn't try. This is the right time to try to do something different, what we used to before.
Okay, thank you. And last question, I think I will address this to other colleagues from Generali again. So there was many of the clients found out like that, especially insurers were like during the COVID-19 pandemic refusing to take over some of the claims. So the question is here, like, do you expect that in the future insurance companies will take over more coverage of these kind of pandemics, or do you think because it's a pandemic and it's not always clear how to deal with this, how much are we infected, do you expect for the future this will still like a topic which will not be covered in the future?
So it's a good question. Actually, it was our experience. One of the first things we did with our marketplace, which are global companies, multinationals, was to identify those coverages in different countries where pandemics were expressly excluded. And in most cases, those were rectified. Those were actually changed in order to, the concern was more making sure that employees were covered for this. Having some, as far as most of our partners, that was actually waived for this in most of the cases, though it was a country by country decision. But even having said that, for the COVID piece, most of the treatment was being done by the public sector. So we saw that even though we made that available in many of the markets, most of the treatment is being done at public facilities. There was a explicit desire by a lot of governments to control where that was being treated. Even in the UK, as Stefan said, they were private hospitals were actually asked by the NHS to take over certain types of care. So we didn't really see as many of the cases as we were prepared for. And I think in the future, I think there will be an expansion of coverage on the private side. I think that's something that they're seeing everywhere, is that there will be an expansion of coverage. They'll just have to assess what that means going forward. But for this particular crisis, at least as the generality employee benefits, we saw most of our partners were waiving that exclusion.
Okay, great. And I think I have to add here, I saw also from our work with our clients and with the insurance companies. So I think during the pandemic, a lot of insurance companies try to solve these claims in a kind of in a cooperative manner to help the clients, because they didn't want to leave the clients behind. And I think also, let's say, many partners on the brokerage side, whatever, everyone was helping each other, and I think this was a really good step forward. So I think with this, I think we can wrap it up. Apologize again, we run a little bit over time. I would like to use the opportunity again to thank especially the colleagues from Europe Assistance and Generali Employee Benefit Network, and also the colleagues from Intromatrix to having the time to preparing this interesting topic. Also, like, big thanks again to the colleagues from the embassies, for the chambers and also the other companies who helped us inviting possible interested people. And last but not least, I would like also to reach out to you and offer, let's say, if you have any questions, if you want to step in a more detailed discussion, what does it mean, how this can be implemented, a global benefit solution or a claims management, a claims reporting, and how you can make more out of this crisis, reach out please to us. We are more than happy to help you in this situation and also going forward. So again, thank you very much to everyone, and that's it. Wish everyone a nice rest of the week and hope to see you soon. Goodbye.
Good afternoon.
Thank you.